are listening to the Health and Wellness Podcast, curated by Dr. Lori Marzell. Dr. Marzell is a primary care physician and a certified menopause practitioner that combines the wisdom of natural medicine with modern medicine to help maintain optimal health. She has a special focus in food allergies and bioidentical hormone replacement. Thank you so much for being here. Enjoy the show.
Hi, this is Dr. Marzell. Today I'd like to talk a little further about gynecological exams, PAP smears. Why do we have to have them? Older patients, should they have them? Shouldn't they have? So hopefully this will be a short and sweet talk, but will clear up a lot of misunderstandings. Let's talk about PAP smears. Why are they important, and why would you want to go and do a gynecological exam with a doctor? Many women tell me that their primary doctor has advised them that they either no longer need an exam or they only need to get one every 3 years or so. These doctors indicate it's really not important to the patient, so the patient somehow thinks they have outgrown the need for them. Here's the continuing saga of why exams are important, including PAP smears and checking for HPV, the virus that causes cervical cancer. First of all, a speculum exam will show cervical lesions, cysts, and infections. A bimanual exam will reveal abnormal masses, which could be a variety of things, fibroids, cysts, or, again, cancer. So we need to rule out a cancer, and this simple exam will help. It also gives the practitioner an idea of pelvic floor strength and health. Practitioners advise patients that when they no longer need PAP smears every 3 years or so, the reason is because they're in menopause, so they don't need them anymore. Well, here's why that advice is wrong. If a patient has had an HPV infection, they should be treated, of course, but it's important to evaluate if it has returned. They can return. Not only can they return, but it can spread to other places. So, especially around the anus and rectal area. When the vaginal tissues change during menopause, untreated women there will have dryness, irritation, and so on. Now, it's important to know if they are having dryness and irritation and tissue signs of deficiency, because you might want to treat them. But it's true that women who are not treated with hormones have tissues that don't that are not friendly for the growth of HPV virus. And so they are less at risk of developing problems because the virus doesn't like the environment. However, if the patient is taking hormone replacement therapy, especially if they're using direct administration to the genitals, which is usually absolutely necessary to correct the tissue dysfunction and reverse it to healthy, normal tissue. So if they have done that, they will be at a greater risk of having HPV or having HPV return. Why? Because the HPV virus thrives in an environment of healthy vaginal tissue. It does not do well in dry, irritated, dysfunctional vaginal tissue. So with women in menopause and hormone replacement, we need to be a little extra careful and vigilant, just as when they were younger. Do pap smears probably every year or so, but certainly not putting them off because you've just, by treating them so they have healthier tissue, they're at a higher risk. Make sure your doctor is checking your urine for you, or take your health into your own hands. Get some test strips, check weekly if you are feeling off. Patients are pretty smart, and having access to check for urinary infections may help you to continue in good health. Hope you're having a healthy, wonderful day.
Thank you so much for listening. If you learned something, don't forget to share with a friend. You can visit us at www.drmarzell.com. We create content for you. If there's a subject we have not discussed or a topic you want to dive deeper into, let us know how we can empower you. Questions can be submitted on our website under the podcast page. Until next time.